Dear students, we'll discuss a topic that is on-table finding during thyroidectomy. All of you know that thyroidectomy is a very common procedure done in surgical practice as well as in ENT surgery practice, and it's a long case kept in the exam. Lot of theory questions will be asked, long major question and short notes, and oxy also it will ask, YO also they will ask. Lot of MCQs will come from the thyroid. So just I will discuss on-table finding. Just see what exactly this one is. So what on-table dissection in this during thyroidectomy, all of you know thyroidectomy technique, you should know. It will be always asked in operative surgery. This one you can always go through my book, operative surgery, and my clinical book, my and manual. It is given in detail technique. SRB manual of surgery, current edition has given detailed technique. So what this, see that this is the flap which is raised above. This is down. You can see that this is the strap muscle here. Somebody is holding it, and you can see the parathyroid areas here. This is in the upper pole. See that it is in the upper pole. So what this structure is, which is very relevant as far as dissection of the recurrent laryngeal nerve is considered. So what this structure is, it is identification of Berry's ligament and recurrent laryngeal nerve during thyroidectomy. When you do thyroidectomy, raise the upper flap and the lower flap, elevate the lower flap, then they open the deep fascia from the midline. Then strap muscle in the large thyroid, you can cut it after applying the two straight Cocker's forceps. And in the upper pole, you do the dissection carefully. And when you dissect the carefully upper pole posteriorly, you can see the condensed fascia, pretracheal fascia. Pretracheal fascia is the false capsule of the thyroid, and condensed pretracheal fascia superiorly and posteriorly is called as Berry's ligament. It is very close to the tubercle of the Zucker candle, that is the lateral analogy of the upper part of the posterior part of the thyroid, where this area, recurrent laryngeal, is very close, which passes behind it and enter the thyroid cartilage to supply different muscles there, where if you injure that, there will be hoarseness of voice and problems. So this Berry's ligament is very important. And another important point about Berry's ligament is, because of the Berry's ligament, thyroid moves upward with the deglutition. Is a very, very clinical point. Why you say this is thyroid? Because thyroid moves upward with the deglutition. Why thyroid moves upward with the deglutition is because of the Berry's ligament. Berry's ligament is attached to the cricoid cartilage, and it is a condensed posterior upper part of the pretracheal fascia. That much answer you should be able to give always in relation to the Berry's ligament. And because cricoid cartilage is attached to the constrictor muscles, so cricoid actually moves with the deglutition, and naturally because of the Berry's ligament attachment, thyroid also moves upward with the deglutition. That is the right way of thinking and relating the Berry's ligament and Zucker candle tubercle as a lateral analogy from the upper posterior part of the thyroid. That is what exactly shown in this on-table finding. All of you know Berry's ligament, what is this? So that is very important point which you have to remember. So a strong condensed vascular connective tissue as a part of thick pretracheal fascia superiorly and behind between the lateral lobe and cricoid cartilage on each side. I said it is a false capsule. Understood that point? You have to remember. And other thing is Zucker candle tubercle. It's a lateral analogy of thyroid in the upper posterior part. These are the two important structures which will guide you to identify recurrent laryngeal nerve, and also very important with where recurrent laryngeal nerve get injured if you are not careful. So you should not use monopolar. You should use a mosquito forceps small hemostat for proper dissection, and we carefully, judicially, you have to use only bipolar cautery so that avoid injury to the recurrent laryngeal nerve. So identify recurrent laryngeal nerve in this area and then go down. You'll be able to get the recurrent nerve properly. Then your dissection of the entire thyroid in thyroidectomy will be easier. So two structures you have to identify and dissect off. They are recurrent laryngeal nerve, one. Second thing is parathyroid glands. Once you identify these two structures, your thyroidectomy surgical technique will be very easy and simpler. So identification and safeguarding these two structures are most crucial and important during thyroidectomy. That is the point I want to tell. That's the significance of Berry's ligament clinically as well as while doing the surgery. That is the point which is very important to remember. So you can always go through my manual of surgery where detailed thyroidectomy procedure is there. You can go through my SRB clinical methods in surgery where why thyroid moves with the depletion, clinical method, how to do that. Different methods of exams thyroid also there in detail with the video also. So Berry's ligament is very important thing you have to remember. And there is a Berry's sign that is encasing of the carotid and carotid sheath by infiltrating the thyroid by the thyroid malignancy. So where carotid artery will not be palpable, that is called Berry's sign. So that says it is due to thyroid carcinoma. Not only carcinoma, it's advanced carcinoma because it's encasing the carotid sheath. So carotid artery pulsation will not be palpable. So Berry's ligament, Berry's sign. So the two things which we have to always remember. Answer the MCQ. Joul's triangle is used to identify external granular nerve, recurrent granular nerve, superior parathyroid gland, inferior thyroid gland. Give the right answer, please. And answer the another MCQ, bigger one. Riddle's triangle is formed by A, B, C, D. Go through it and find out which is the right answer. And eventually I will put it into the comment box, the right answer. So quotation of the day, student, please just go through that. It will really give the happiness for you to read these quotations. In surgery, you have to learn to be comfortable in uncomfortable zone. Remember, living in a comfortable zone is easier. Living in an uncomfortable zone is difficult. You need to learn. It's a part of life also. Live in an uncomfortable zone. How you deal it. That is a more crucial, most difficult thing. That you have to learn. That is what exactly this quotation says. So students, please go through my SR-based clinical methods in surgery, current edition, which gives in detail about the clinical exams, all chapters, including X-rays, other images, basic instruments, specimens, and gives a very lot of photographs are there, figures, illustrations are there for your benefit. Detailed clinical methods and case sheet rating is there. That's very important for clinical surgery. And manual of surgery, current edition, gives a detailed discussion of all topics, specialties, urology, cardiothoracic, and other chapters, including instruments, operative surgery specimens, as per CBMA syllabus in detail for your knowledge, exam, theory, clinicals, everything. Please go through that. And of course, my operative surgery book with the 2 volumes is very useful to understand the every operative procedures, the step-by-step technique, and my atlas of tissue approximation, small book with a video. All this contains a video of demonstrations of different things. It also gives a suturing technique very briefly, very nicely, and with the principles. Please kindly go through that. And my SRB surgery insights and YouTube different channels, my website. You can please subscribe. That will give a lot of information and it will be very benefit for all students. And please subscribe my SRB surgery insights of different modalities for understanding better knowledges and subjects, because different topic, different versions are there in small topics in the website, and this is the QR code for the same. So students, I hope you have understood this Berry's ligament topic very well. Thank you very much.